Hi, good morning. My name is Dr. Praveen Rao. I'm an orthopedic surgeon at Yashoda Hospital, Secunderabad. I specialize in joint replacement surgery and pelviacetabular fracture surgeries. Today I'm going to talk a little bit about joint replacement surgeries. So in a knee replacement, what happens is that the damaged part of the cartilage and the bone are carefully removed and they are replaced by a prosthesis. This is called as a knee replacement surgery. The benefits of this knee replacement surgery is that you get rid of your pain, your functional ability increases, your walking distance also increases, you can start climbing stairs, you can do all your normal day-to-day activities, and after a particular period of time, once you have been rehabilitated, when you can also go back to doing certain sports like jogging, playing tennis, badminton, etc. As with any surgery, this surgery is also associated with certain risks, and these risks are pretty rare and they amount for almost about 2 to 3% of the cases. The commonest problem what we face is infections. Our infection rates are pretty low. We report about less than 1% of infections in our practice here. The joint over a period of time can get loosened. Sometimes you can get blood clots in the veins of your legs which can travel up your vessels and go into your lungs, which is called as pulmonary embolism. Sometimes if your bone is pretty weak, you can get fractures around the bone. So these complications are very rare. You need not be worried about them. The most advantageous thing is that your pain will go and your functional ability increases.